Okay, everyone. So I've been a little bit ill, and I think I confused myself a little bit on the topics I was presenting on. So I already did a live training today. I presented on two topics, but then I realized I didn't present on the actual topic we were supposed to talk about today. So um, we're going to do that right now. So you get basically three live trainings in 1 week, which is amazing. And I hope you enjoy them. Please don't hesitate to reach out if you have any questions about any of it. It's like a ton of information in 1 week, I realize. Oop, but I just want to make sure that you have it because I made it for you. Okay, so kind of going on the topic for what, along with the topic for what we've been talking about all week, which is just kind of our narrative, that story that we tell ourselves about our chronic pain. And this topic really matters because I think, many of us can say that we've left a doctor's appointment feeling worse than before. And I'm curious how you would feel if I told you that it is possible that the way your well intentioned healthcare provider talked to you about your pain could actually have made it worse. So, today I'm sharing the secret to breaking free from that fear and kind of transforming your pain story. And as I always do, I'm going to introduce myself before we dive in. I'm Dr. Anna Redmond. I'm having a lot of problems today, like figuring out what I'm supposed to teach about after like a couple weeks of illness and feeling away. But I am a trained psychologist, a clinical psychologist with a specialty in chronic pain. I'm also a chronic pain strategist for women. And I've always believed that your pain is exactly as you describe it, that your pain is real. And guess what? I always made sure to let people describe it. That's right. Listening, active listening, hanging on to every word they use to describe their pain experiences. So that's just a little bit about my style. And I really talk to people about their stories. Their stories are important. Like, literally no word goes wasted in my mind when someone is telling me their pain stories, their narratives, their experiences that have shaped everything for them in this chronic pain journey. And one of the things that I help women who are struggling with chronic pain with is teaching them how to take control of their pain and rewrite their pain narrative with clarity, compassion, and confidence. And this changes the trajectory for moving forward through a huge empowerment shift. So I'm here to show you that your pain does not define you, and you have the power to take back your story. Before we get started, if you are considering my Breaking Through Pain program, it's my 3 month long coaching program, and you're ready to take the next step, I invite you to book a call with me. During this call, we can map out the strategy that will help you regain control over your pain and break free from those cycles of fear, frustration, and flare ups. So the link is here in the comments. And if you have any questions or just want to like see if it's even the right fit, my DMs are also always open. You're welcome to reach out anytime. I'm pretty active there. But let's jump into it. So I know that many of you have likely been told by doctors or specialists that your pain is something that you'll have to manage for the rest of your life with no real hope of recovery. And I'm even willing to bet that you've heard statements like, this condition is chronic, or you need to take pain medication indefinitely, or even you should avoid certain activities from now on. And for many of you, this has been reinforced over the course of several appointments, maybe several years, maybe decades, leaving you with the belief that your pain is permanent and your life is limited because of it. And in these appointments, even from well intentioned providers, you might experience a very clinical or pessimistic approach to your pain. So, providers often focus on managing symptoms rather than exploring the root cause. They might prescribe medications, recommend surgeries, or tell you to stop doing activities you love because they believe these activities will aggravate your condition. It's also common to be told what your limitations are rather than what you're capable of. And this could come in the form of a long list of things you can't or shouldn't do, like avoiding strenuous activity. It might make your pain worse, or you should avoid bending, lifting, twisting. Be careful when you're exercising. Try to stick to low impact movements only. And these statements, even if they're meant to protect you, can leave you feeling fragile, broken, or afraid of making things worse. And the language and the tone used can unintentionally reinforce a sense of hopelessness that sticks around for a long time. It can make it feel like the medical system is boxing you into this life of limitation and caution. And one of the most common ways that fear is amplified in the healthcare system is through the language used when delivering diagnoses or interpreting medical tests like MRIs, x rays, or other imaging. So many of you may have been told that you have degenerative disc disease, bone on bone arthritis, or have been shown concerning images of your spine, joints, or muscles. And these terms can sound really alarming and make you feel like your body is deteriorating or beyond repair. Maybe someone has even said to you, this is a sign of wear and tear. Your body's aging faster than it should. When coupled with recommendations for invasive procedures, such as surgeries or injections, or even the suggestion that nothing more can be done, it can feel like a death sentence for your mobility and your quality of life. And so this is after 15 years of talking to women with pain. This shows up quite a bit. The result, though, because I always see them after, we're still not at a place in healthcare where we're always having the psychologist in the pain on the pain team see the patient right at the beginning. And so I always see them at the end of all of this, where the result is heightened fear, increased hypervigilance about their body's fragility, and a sense of hopelessness, all of which increase the brain's threat response and can worsen the pain experience. While these tests and procedures can have their place without the right context and education, they often fuel unnecessary fear and keep you stuck in a cycle of anxiety and avoidance. And so here's how this impacts what you believe about yourself and your body. When this is the repeated narrative you hear from medical professionals, you start to internalize it. You might believe things like, I'm never going to get better. I'm stuck like this forever. My body's too fragile to handle normal activities, and I have no control over my pain. And the problem here isn't that these providers don't care. They do. They're very well intentioned, but the way they approach your pain often focuses on what can't be done instead of exploring how you can take back some control. This disempowers you and it keeps you in a passive role, believing you have to wait for the next medication, treatment, or diagnosis instead of helping you explore active, empowered steps toward relief. But here's the truth. I'm always going to show up and tell you the truth. That language that is part of why, that language that you've heard is part of why your pain feels so overwhelming. When healthcare providers unintentionally reinforce fear and threat through the words they use, like warning you to avoid certain movements or emphasizing damage in your body, it sends a powerful signal to your brain, a real signal. This signal tells your brain that you are in danger, and as a result, your nervous system goes into high alert, and this is the fear threat loop. Here's how it works. When you hear fear inducing language, your brain interprets as a sign that your body's under threat. This increases the brain's sensitivity to pain signals, making your body more reactive and amplifying the pain you experience. It's a self-reinforcing cycle. When you're afraid of hurting yourself or constantly worried about making things worse, that fear heightens your brain's threat response. It keeps the pain cycle going strong. And that's why, despite following medical advice or trying new treatments, many people feel stuck in the same pain pattern. And the fear and the threat created by well-meaning but misinformed language from healthcare providers often prevents any real sense of relief from setting in. So without addressing this fear threat loop, you can stay trapped in a cycle of hypervigilance and increased pain sensitivity, never getting to the root of your pain or finding the relief you deserve. And the fear threat loop doesn't just affect your body, it deeply shapes your personal narrative. So here we are back at the word narrative. When you've been told repeatedly that your pain is something to be feared or avoided, you start to internalize that message. It becomes part of your story. You may begin to see yourself as fragile, broken, or limited, believing that your body can't be trusted and that your future will always be defined by pain. This narrative keeps you stuck. It reinforces feelings of helplessness, and it diminishes your confidence to take control of your healing. Rewriting this story is essential to breaking the pain cycle and reclaiming your power. And that's why we focus extensively on rewriting your pain story in my Breaking Through Pain program. We understand that your pain story is not just a medical issue, it's deeply intertwined with how you perceive yourself and your life. And I like to think of this as a narrative reframe or like a healing narrative shift. It's a change in your story that we need. This is where we take a deep dive into your current pain story and transform it into something that's more uh, indicative of empowerment, resilience, by shifting the narrative from one of limitation and fear to one of possibility and strength. we break the cycle of that fear threat loop and we enable you to reclaim control over your life. This approach isn't about changing how you talk about your pain, it's about fundamentally altering how you experience it and how you can move forward with renewed clarity and confidence. So, let me tell you what I mean by rewriting your pain story, because I don't want this to seem abstract to you because it's not abstract at all. So rather than letting the fear inducing words of others define your experience, you need to take back your story. And this starts with two key steps. The first is self reflection, the first step, reflecting on how the language from past medical appointments has shaped your perception of pain. What labels or phrases stick with you, and how have they affected your self confidence or your view of your own body? And to truly grasp the impact of medical language on your pain experience, it's essential to reflect on why certain terms and labels resonate so deeply. As part of my Breaking Through Pain program, I provide targeted prompts to help you explore this aspect of your journey, like, why are terms like chronic, degenerative, or irreversible so impactful? How have these words shaped your view of your condition and influenced your self confidence? These and other prompts are designed to help you uncover the emotional weight carried by these labels and their role in shaping your pain narrative. By delving into these questions, you can understand why you might feel despair or hopelessness and how these feelings affect your self image and your overall well being. Reflect on how these past experiences have altered your perception of your body and your ability to manage pain, as well as your own perceived ability to cope or do something about it. Reflecting on how these past interactions have influenced your self-image is also crucial. So it's not just about the physical pain you experience, but it's about the internal narrative that's shaped by the medical discourse that you've had. And the goal is to move beyond the limiting beliefs fostered by by medical language and start rewriting your story. So the outcome of this for my clients is that they can rebuild a positive, resilient view of their bodies and its capabilities, and it empowers them to take control of their own healing journey. My clients that have the most success with this are those that come into this process with an openness and a willingness to explore, and that take the time to explore it rather than skipping over it. Even if you skip over it, you'll end up back there at some point anyway. We always do. The second step is compassion and clarity. So we begin to replace those fear-based words with compassionate ones. This is where self-compassion training comes in. You have to give yourself the grace to acknowledge your pain without letting it define you. You deserve to trust your body again, and that starts with how you talk to yourself. Understanding and addressing the impact of fear-based language is crucial for transforming your experience with chronic pain. Now, I know this sounds like a soft science, like the unimportant stuff, like woo stuff, but words, stories, narratives, these are transformed into chemical reactions in our brain and body. These are the things that can set off our nervous system. They have a very physical effect. And the terms and the labels used by healthcare providers can deeply affect your self perception and your emotional well being. So, when we replace these fear based words with compassionate and affirming language, this is a key step to regaining control and fostering a positive self image. In my Breaking Through Pain program, I guide clients through this process by incorporating self compassion training. And this involves acknowledging your pain with kindness and understanding rather than allowing it to define your identity. So we focus on giving yourself grace and learning to trust your body again. And through personalized prompts and exercises, as well as strategy, coaching, implementation calls, you will replace limiting fear inducing terms with language that reflects your strength and resilience. And it's amazing to see how the women I work with come into my program using one set of language and leave my program talking about it all in a completely different way. And this shift is essential for rebuilding your self confidence, creating a healing narrative that empowers you to engage in life fully despite any sensations you're experiencing. And that's where healing happens. By nurturing a compassionate inner dialogue, you pave the way for meaningful change and lasting relief. So we work together in these calls and in my program to replace limiting fear inducing terms that reflects your inherent strength and resilience. So we're really together taking a deep dive into how certain medical labels and phrases have shaped your perception of pain and influenced your self-image. And we explore specific examples from your own experiences and identify words and phrases that have contributed to feelings of fear and inadequacy. And once we've pinpointed these terms, I guide you through a series of exercises designed to shift your mindset. This might include rephrasing your pain experiences using more empowering, compassionate language, practicing affirmations that reinforce your capability and your worth, and developing a narrative that highlights your progress and your personal strengths. So the shift in language is not just about changing words, it's about transforming how you see yourself and your pain. Humans are people of stories. We are always telling stories. We think about things from a beginning, middle, and end standpoint. And when we consciously choose to replace the words, the fear based language in our story, with affirmations of strength and resilience, the story can rebuild our self confidence. Its new empowering narrative helps you engage with life more fully despite any challenges you may be experiencing. We're creating a healing story where you're in control, you're capable of managing your pain, and you're deserving of a fulfilling life. So, let me tell you what I mean here. When you replace limiting fear inducing terms with language that reflects strength and resilience, you alter your emotional and physiological responses to pain. Fear and negativity creates a barrier to progress. It keeps us stuck in a cycle of anxiety and hopelessness. And when we reframe the narrative with compassionate and affirming language, we actively kick this barrier, we reduce it, which opens the door to a more positive and proactive mindset. It increases self confidence because you're viewing yourself as capable and strong. And so then you're more likely to engage in activities and practices that support your recovery. It reduces fear and stress. So when you start seeing your pain, when you stop seeing your pain as an insurmountable challenge and start viewing it as something you can manage, you lower your overall stress levels, which helps to mitigate pain sensitivity and improve overall well being. We see empowered decision making with a positive and compassionate narrative. You're more likely to make empowered decisions about your treatment and your daily activities. You're focused on possibilities and solutions rather than limitations and obstacles. And it creates an enhanced engagement in recovery. So again, you become more engaged and motivated in your recovery process. Um, and then we're kind of reinforcing a healing narrative. So this is built on strength and resilience, and it empowers you to view your journey as one of growth and recovery. And this can help set you up for navigating setbacks with greater resilience. So if you've ever felt like the words of your healthcare providers left you feeling more fearful or confused, and you have this narrative that may be keeping you from being empowered in your own recovery, it's time to take back control. We can put so much of that control back in your hands. So if you're ready to rewrite your pain story with clarity and compassion, I would be honored to guide you through that process. And if you're ready to take that next step, I invite you to book a call with me using the link in the comments or going to drAnnaRedmond.com/discovery. During our call, we'll dive into your current pain management strategies. We'll identify the key areas where you can make impactful changes. We can talk about how my program can leverage your strengths and skills and help you break free from that cycle of temporary fixes, empowering you to move forward with a success that's more self-led by you. So drop me a message, comment book below, or click my calendar link. Alternatively, if you really feel like you want to discuss this further before booking, feel free to send me a DM. I'm going to ask you some questions and we can sort through what's going on. I'm totally here to help. Let me know how I can. I don't see any questions in the comments. I'm going to end my third training for the day. I hope you all enjoyed it. Leave a comment. Tell me what you enjoyed about it. Tell me what resonated. I love having these conversations and having it all be very active. So I hope to talk to you all soon. Bye.